do, and with the data centers and everything. So it's just,
That ought to help me out better.
I think he's thinking, I heard rumblings about like maybe they're thinking a data center by here. Yeah, like let's reject it. We don't need
Well,
that.
so the problem is you can't watch it because they just do you for zoning or whatever. We were trying to.
I'll go ahead and call the meeting to order. I have 5:02. I'll go ahead and begin with the roll call. Thank you, Amy.
Dr. Jones?
Here.
David Thies?
Here.
Kathy Emmanuel? Dr. Peterson?
Here.
Dr. Sharma?
Here.
Dr. Sander? Dr. Goodley? Beth Manich Thurman?
Here.
And Dr. Reistup.
I gotta get a doctor.
Thank you very much, Amy. Before we go any further, I wanted to recognize that we have some additional personnel here. So Amy, Mom, if you'd like to do any introductions.
Yes, so Amy Frederick is our new executive assistant for the admin, and the main purpose is to make sure that she took Amy's role as with transitions, but this Amy Amy Roberts, I think she has been mainly focusing on HR, so we want her to still do that. So we bring Amy Fredericks to help, with the board stuff.
Terrific. Well, welcome, Amy.
Thank you. Nice to meet you.
Very nice to meet you. And we look forward to working with you, and we greatly appreciate everything that everyone has done here. And Amy has just been an absolute amazing resource to us. So thank you so much. Moving on, I'll go ahead and entertain a motion to approve the agenda for this evening's meeting. Do I have a motion? Moved and seconded? Okay. Moved by Bethany, seconded. Any discussion? Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions? And then our next agenda item is approval of the minutes from our last meeting, which was on March 24th. So I'll entertain a motion to approve the minutes.
Move to approve.
Moved and seconded. Any discussion about the minutes?
Yes, I have a little. I thought they were basically pretty good minutes. The only thing I would like included is the discussion, as I think I led, about the 25 to 35% of what. And to specify in there that our budget is 1.2 million, not 2.2 million. And the difficulty in separating that out that the county executive is having has made it difficult for us to focus in on the proper 25 to 35%.
Thank you. I appreciate that. And then I also just wanted to, for the items on our agenda, we had invited Travis to be here at this meeting, and also to, prior to this meeting, provide language to us for a bylaws change so that we could be very specific with that item on the 25 to 35%, or delineation to 30 to 35, which we were kind of discussing at the last meeting. I have not received that language, and it was his intent to be here this evening, but he's not able to be. Amy just informed me of that, so we will again invite him to the August meeting, and in the interim, still try to obtain that language for that change.
I definitely think you want to have him at the August meeting.
Yes, yes.
The one point I want to make about that, there's several of you who've been on here a long time. I've been on here a real long time. We never had any trouble separating out the district's revenue from ours on the property tax. Deb Busey did it just fine. I sometimes space her name, but the woman who was taking our staff position at the county level had no trouble. So the only time we're running into trouble is the current administration. In fact, I could probably do it.
I believe
Careful what you say.
Yeah, I moved to approve.
Sounds like a motion to me.
Well, I appreciate that, and we can make that correction. Did you get that, Amy? Thank you very much.
Tammy Ogden.
Oh,
Tammy.
yes, you're correct.
Tammy
Yes.
moved, yeah.
Yeah, she's over she's in,
RPC.
the grant RBC, yeah.
Any other items for changes on the minutes? Hearing none, all those in favor?
Aye.
Aye.
Anyone opposed or any abstentions? Thank you. And acknowledging that with 5 of us here, we do have a full voting body for participation in voting on items. So our next item is public participation on our agenda items. So I see we have some public with us. So if you'd like to introduce yourselves and if you have anything that you would like to say on any of the public items, this will be your time to speak freely about this.
I'm Jennifer Henry, I'm the CEO of Thomas Healthcare. We came for a portion that's about the grant. We're so appreciative of previous year's grants, and dental remains are very, very expensive, as you all know. Certified to support what we feel is so important for holders of health. So the assistance that we received is really outreach, so we would like to continue if we can.
I'm Eddie Green, I'm the VP of Operations at Thomas Healthcare.
Thank you both. And we will be taking that up a little later in the agenda, so if you have questions, it's nice to have you here so we can have you answer those to us. So thank you very much for being here. So I'll move on to correspondence and communications. Mamadou, do you have any announcements for us?
Yeah, just a few updates. So this past 6 months have been very challenging for us. So a quick update. I don't know if you have seen it already in the news, but we had a cybersecurity incident. We responded really well. We're still in the process, but during the process, we activated our insurance company to help us. So they hired 2 consulting firm, 1 law firm and 1 IT firm. So the legal team, they told us not to share anything publicly. So just want to give you a heads up that we're handling it really well. We just need to wait until we get the full forensic report before we say anything, because it would be, when questions are asked and then we answer in complete fact, so that won't be too horrible. So we just want to make sure that we have the complete facts throughout the forensic report, and then we will be happy to share that and whatever we did in the process so that other organization can learn from what we did. But just to reassure that, after a week we were fully restored and fully operational. But just don't want to get into detail now until we get a full forensic report. So that's the first update. So that was May 7th, and on May 15, IDPH, Illinois Department of Public Health, sent an advisory health report on antivirus. I'm sure you all probably heard that also. Cruise ship, antivirus on regular cruise ship. I think the last update as of today was that 8 people are still under the quarantine unit at the University of Nebraska for public health monitoring for 41 days. So that's the incubation period for antivirus. And then 10 people. 8 people are in quarantine and 10 people return. And they are still monitoring them at home, but until the 41 day is completed. So we were in that, and then we're in learning about all of that, and then we had 1 separate cases in Illinois. That's not related to the cruise ship or anything like that, but it was separate cases, and they handled it really well, but we're worried about that, so we're learning about that. So, And then after that event, I'm sure you all know about the Ebola outbreak in the Congo, Congo, Uganda, and South Sudan. Since Champaign County has a large population of Congolese, so we were in the upfront of that. Sorry.
You're fine.
So we're in the upfront of that, and right now there is travel restrictions that the government, CDC, are doing. So any travelers from those affected area or countries, they are only allowing U.S. citizens to come in with low risk. So if you have any symptoms, even not related to COVID, you are being sent to another country, Germany and Canada specifically, to be treated or evaluated. But right now, due to our populations, higher populations of Congolese, so we are still monitoring travelers who are citizens, but Congolese Americans. We're monitoring them, and they're all low risk as we're speaking, and so no current updates. We don't want to share also any related information about the numbers or total numbers that we're evaluating. I just want to give you guys a heads up that most people in our jurisdiction are very low risk. But we also are doing the 21-day monitoring, outcome monitoring, precautionary monitoring, just to make sure that if anything, if they develop any symptoms or signs, so that we are the first to be notified, and with IDPH we can coordinate their isolations and treatment through two centers. One is with the Rush Medical Center, and one is with the Lurie Children's Hospitals in Chicago. So those are the update, but very stressful and challenging couple of months for us. But all of them are really being carefully and monitored, and I'm very happy for the response that we are doing on that. So beside that, low stressful, less stressful components are seasonal infectious disease, so West Nile virus. So one of the things that we do during seasonal West Nile virus time is that we have part-time mosquito bikers, mosquito abatement bikers who would bike around the county and treat any water stay with larvicide to kill mosquitoes. So they have been very successful, and they also do traps around the county to see where we have West Nile's cases. So we did a news segment with them, so just people can learn more about what they do. But most of these folks are students within the university, entomology students and communication students. They really like the work, and we are very grateful to have them as an addition to our team. So West Nile, tick-borne illnesses with Lyme disease, we don't have any cases as we speak. Year to date, we don't have any cases for either West Nile or Lyme disease, which is very prevalent in our area here. And for rabies, year to date, we have 8 cases of post-exposure prophylaxis. So people who have been exposed to bat and felt at some point that they had some interaction with bats, so they go to a series of vaccination just to be protected. So we have year to date, we have 8 cases for those. So we're still early in the season for that, but we're monitoring all of those very carefully. So for environmental health, so we had one environmental spill at the rental food. And I know since this is the county board, I'm like, I need to bring something county related. they were able to mitigate, it was, I'm sure you all know rental foods, so they do butcheries for pigs. So there was a lot of animals blood clot in the drain, like a lot. So they were able to unclog it, but it was spilled to a drainage, water drainage. It didn't affect water drainage, so we were in an inspectable place. They followed the protocol. They contacted APA, take pictures just to make sure that everything was in block and write a report. So we went there to inspect the area, get the report, and send it to APA and IDH. So that is all the update for me, but if you have any questions, I'm happy to take them. I wanted to also talk briefly about I know that Dr. Peterson usually wants us to talk about some of the report that we have for our infectious disease with the county compared to CU, Champaign-Urbana. We have some of those, but I don't want to take too much time, so if there is need to talk about it, I will. But specifically for our sexual transmissible diseases.
Questions?
No, I'll live with that.
I think that's the first time. So I'm very happy about my report.
Well, that certainly is a lot, and, you know, on the tick front, I can tell you, as someone going through this last set of storms, there seemed to be a great amount of them that I'm hearing, you know, people are interacting with from Kickapoo to other areas, so I'm just wondering if, you know, no pun, but the calm before the storm, before we start to see more of those uptick, just simply because we've had a lot of down trees in the area.
Yeah. Yeah, so we did a lot of news, press release, and also media segment to just talk about most of these infectious diseases. I think we talked about hantavirus, and then we also talked about West Nile and then Lyme disease, just so that, you know, people know where to look for those signs and how to remove ticks and ways to remove it. We shared links about how to do it step by step, and also share our disease investigators their contact information. So if they have any questions, they can reach out to those folks.
That's great, that's wonderful. Any questions from anyone? Thank you, you're doing a great job.
Yeah.
Thank you.
Thank you so much. We're very lucky to have you in the community, and thank you for handling so many of those things so very well.
Yeah, I called Julia and I said, do you know?
Of course she does. She's always everybody. Terrific.
Yeah.
Our next agenda item is Smile Healthy. We have monthly reports for March and April. So I would entertain a motion for approval of both of those reports if you wanted to do those collectively.
I'll motion for omnibus for those ones.
Okay, thank you.
Second.
Moved and seconded. Any further discussion about those reports? Questions? Hearing none, all those in favor?
Aye.
Aye.
Anyone opposed or any abstentions? Thank you. Our next is approval of the invoices payable to the Champaign County Administrative Services for the Champaign Dental Access Programs for March of 2026 and for April 2026. So in the same regard, I would entertain an omnibus motion to do both of those together unless you would want to divide them. So moved.
Second.
Moved and seconded. Any discussion about those reports and payments? Hearing none, all those in favor?
Aye.
Anyone opposed or abstentions? Thank you. That then takes us to CUPHD and an update on the health education program.
There should be a handout in your packet, just of the places that we've been the last, however long since it's been that we've seen each other, so the last quarter, I guess. So we were at Rise Academy, which is in Rantoul, Fisher High School, the Ready program, and the Juvenile Detention Center. So I think we saw about 90 students, 80, 85 plus, 89. And then there's some student takeaways there. They're always very grateful, and they always are telling us how much they learned and how much they appreciate the programming. And then for the next school year, the fall and winter 2026, we're looking at Thomasboro, Fisher Junior High, and then back to the Juvenile Detention Center and Ready program. We're still working with trying to get into Ludlow. That's one that has been tricky, so still working on it.
Thank you. Any questions for Whitney?
Are there any other places you're trying to get into, or is that?
My unicorn would be Rancho High School. That has been a tough one. They basically kind of shoo us away upon any reach out. But we have been at Ader for 10 plus years, and we do all their 8th graders. So we'd love to get into Rancho High School and do like a, I don't know, booster lesson or whatever they want to call it for the 9th or the 10th graders. But we haven't been able to do that yet, so we still try every year.
What's their issue? Why?
We get different answers depending on who we talk to, but it's really, most of it is the teachers teach it, and they're fine with the way the teachers teach it, which is fair. But we think we could do better, of course. And then it's a nice perk to have like a neutral third party doing the education instead of like, your health teacher, if they have it with a different teacher. It's a neutral third party, kind of a nice perk of the teacher, for the teacher, so, yeah. Any other questions?
Our next agenda items are approval of CPHC invoices for February, March, and April of 2026. So those are in agenda items 11 through 13. So same thing, I would entertain an omnibus motion to do those collectively, or we can separate them if you want to discuss individually.
Move to do it. Second.
Moved and seconded. Any questions, any discussion? Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions? Thank you. That takes us to items 5 and 6, CUPHD reportable duties and the performance management reports. So the same thing here is I would entertain a motion to collectively place both on file as an omnibus motion, or we could again discuss those individually.
Move to do an omnibus motion.
Moved and seconded. Any questions? Any discussion? Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions? Thank you. That then takes us to old business. Our first agenda item is an update on the long-term care beds in Champaign County. I regret that Kathy could not be here to share some of the wonderful news that's been ongoing. I can share on her behalf and on the entire collective body that's been working on this, that an additional $500,000 has been received from the state to continue the efforts and the work to secure a senior living facility in our community. And I know, Mamda, you've been at some of those meetings, so I'll let you offer any additional insights that you have from some of those conversations.
We had a really great meeting. So they came here, Advocate for Aging. So they came here and shared their initiatives. And I think before Julie even left, we went to a meeting where they were inviting someone who was planning to, I think, build the greenhouse model. Very great idea. So I think the model is really good. But what impresses me the most was the staffing. So the staffing model is very unique in the way that it's someone would come to the house and help 2 to 3 senior and get to know them on a personal basis. And the shift is very malleable and flexible. So personally, I have in college I did the job, and I just know that it's extremely important to have stuff that they get used to for a long time, and not stuff that comes and leaves. So it's very difficult for older adult to or elderly when people comes and leaves, they have a very difficult time of confidentiality and being vulnerable with those. So I really like that aspect based on my personal experience. But I also like the aspect in terms of food safety, right? Like we were always worried about inspections but the idea they brought on the table is to train those folks to also be food, to get food permit, food handler permit, which will allow them to know all the element of food safety, because they will be trained in also making healthy food for the clients. So I really like the model, and we were very supportive of it. I think at the beginning we did their initial survey or data analysis just to show the need of nursing home in the county. So I think overall I'm really supportive of it, and I really want to see the group take the idea to the next level. I think there is a lot of concept that we're talking about right now, and approval, but I want them to push forward and really conceptualize whatever their plan is, so that we can see it in reality.
Thank you. I know there's been a large contingent of university personnel that are also serving on a council with this group. I have to be one of those from the nursing aspect, but engineering, education, a lot of individuals that are involved in the conceptualizing of engineering students being a part of the build, and how can the community health worker population through population health that you're talking about in some of those pods, and then how do we, have nurses and nursing students who are trained in these areas, or medical students in these areas, or population health, and many of the other colleges across the university. So yes, I do think it's a very large community contingent, because they pulled in, Carl and OSF, all of the bodies, Christine, everybody's, at the table, and so they're really pulling from a wide number of resources.
One thing unique about it also is that in collaboration with university, they want to make it a pilot research on it for to study how the greenhouse can prolong the life of people who live in, and how their safety and health, and the ability for them to not contract infectious diseases when it's flu season and COVID season. So I think all of those really, I'm excited about seeing that and being a pioneer of that in the county. So,
Is it proposed as a for-profit or a not-for-profit operation?
I think I can't talk too much about it, but I think during our conversation I asked this, and I think their plan is to do a 430B. You want to speak on that?
401c.
401c. Okay.
501c.
Yeah, 501c.
My apology.
Yes.
Yeah,
Not so
501.
charitable,
Yes.
not
Yes.
for profit.
No for profit. Yes. Yeah.
Yeah, I think that is correct. That's what they're looking towards.
But maybe we can check on that just to make
Yes,
sure.
yeah, that's what I recall also, and I know that they were looking at two, I think they're down to just a couple, 2, maybe 3 parcels of property that they're looking at in the area, so, hopefully when Kathy comes to the next meeting in August, she can give us some additional information on all of that. The next agenda item was a discussion of the County Board of Health bylaws change. If you recall at our last meeting in March, we had talked about having some specific language in the bylaws that follows our previous, from 2 years ago, discussion at a meeting where we voted that we would maintain a fund balance of 25 to 35% of the overall budget should we ever have some type of a situation, a disaster, a tragedy, an outbreak, that we would have to utilize those resources in the immediacy for without reliance on any federal or state funding beyond our own internal funding. And so we did vote on that, but we had not really put that language into our bylaw. So we discussed having some specific language. And I did reach out to Travis Whitlock about getting some of that additional language. I have not received that, and it was his intention to be at this meeting. He was not able to attend, so we are re-inviting him to come for the budget meeting in August, and then to also bring forth some of that language. And if I get it prior to, my intention will be in the minutes and other information in your board packets to send that potential language out for you to review prior to that meeting for vote.
Let me suggest too that this ought to be put in front of the county's state's attorney.
And also, I mean, we exist as a creature of the order of the statute. And most of what we do, but is ultimately approved by the county board. And I've participated in previous revisions of this document.
Yeah.
But I don't know, I'm not quite sure what the chain of command is. So you say we're adopting this as a bylaw, but do we then ask the county board to approve what we've
To
done?
approve the bylaw, that's a good question, David.
So-
That would be a state's attorney's question.
Yeah, that's why I think we need to get the state's attorney's office to review this. If there's any, if that discussion is finished, then I actually read the damn thing. Actually, I think I worked on this before you did.
Before I did.
Yeah, I think, so I was wondering, I've worked on several, I was saying, I think I looked at this, but I don't remember it. I have a couple of questions, because it states on the document that it was revised last in 2012. So there's been some changes of county structure since then, and so I just have some questions I can't answer. Who makes the appointments to this board? Is it the county board chair, or is it the county executive? Right now, it says the county board chair.
That is a kind of a evolving question.
Yeah, that's what.
I think that leaving it as the county board chair currently is probably fine, because the county executive's position, responsibilities are not clearly delineated. They're basically like two things they do. They run like the administrative parts of the county, and they kind of stand as a response to kind of attorney charges and things like that.
So, of course, what's coming up is a third of us are going to be facing reappointment this year.
That goes through the board as a whole. So, you guys nominate, it goes into the board's minutes, and then, for the board's agenda, and then we vote on it. There'll be
So
five-
your county board chair, not the county executive, your county board chair would make the appointment?
With advising consent.
With the board, yes, of course. Yeah, so it's initiated though by your elected county board chair.
I believe so for this one.
All right, yeah, and I was confused on that too, and you're right, it's there, it's
Yeah,
somewhat
currently it does
murky.
still say county board chair, and I don't think, the current county executive is going to, fight for the.
It's gonna fight for the honor?
Yeah, I think the board chair will be fine with whoever we put up there, and then they'll.
We could have a mud wrestling match,
Yeah.
yeah. Or
According to
actually put it on the
Illinois
lawn of the White House,
exactly.
yeah. So, then, when you get to the secretary treasurer discussion, it says shall keep minutes,
Yes.
right, keep records. No, literally, they're not doing that. The treasurer needs to probably assure that records are being kept, but the treasurer is not going through these records.
Do we send copies of the records to each other?
No,
Where are they kept?
no, I was treasurer for, I don't know, 15, 18 years. I never saw it. Early, before Julie was appointed, we had very contentious meetings on the budget, and there was a subcommittee that I chaired that put the budget together over a period of month and a half usually. Once Julie got appointed, we came to an accommodation, really, in terms of how this board would contract with the district, and that wasn't necessary anymore. You know, the way she did it was really enhancing our ability to program, rather than what was happening before was an explicit attempt to shut us down.
Really?
Yes, by Vito Palazzo. So when Julie got in, we took a view of our budget and our contract with the district as enhancing basically their budget and also enhancing what's available to us in terms of programming, and it's worked out very well. And so, but we have not, as a board, any of us, except maybe you, have been terribly involved in the actual fine tuning of the budget.
One thing that changed between Dave's tenure, well, going back to Gail, to Dave, to Vito, to Julie, one thing that changed along those lines is that when Julie took over, we had, she understood that individuals here, it made more sense for us to be funding parts of individuals here, and thus then we had resources to keep those records in Mandy and Amy and the personnel here. So there is a repository of things kept here, rather than we used to be, underneath the previous tenure, we used to be more separate body, you know, and there was also levying structures that changed during all of that time too, if you recall. So I do agree in that aspect, then yes, we could rewrite for that position change. And I don't think in here also we have liaisons from the health district that are portions of their salary come out of the county Board of Health budget that, you know, provide support to this one.
I had forgotten that we have standing committees.
We do.
Yeah,
Which we don't operate.
where they're standing, yeah, right. Fiscal year, December 1st, it has been confusing me for quite some time. Is our fiscal year December 1st? We talked about that a meeting ago, because it changed. Some aspects of it changed to the calendar year. So is that now correct for the fiscal year?
I don't know what's correct. I'm remembering that one had to do with the typical budget year and fiscal year for the grant that we
Right,
get, which may be different than the county's.
In the county's fiscal year,
And
right?
I don't know how that landed, but those were the issues.
Mandy, do you want to clarify on that?
It's the calendar year, what the calendar uses.
So that's a potential change.
Okay. Now, this gets into a really sore point for the county board members. Audit responsibility is the responsibility, it says in the bylaws, of the county treasurer and not the auditor.
In the county bylaws or in the?
In these bylaws.
Oh.
He said, doesn't mention the auditor. Now, it does mention the auditor, provision of an annual report involves the auditor. So, who wants to walk on those hot coals?
You're talking about the last sentence of Article 11?
Or, I think so, yeah, I
That's-
forgot
that's
to
not
put
the
the
auditor.
article numbers down.
That's not the auditor, that's a certified auditor. I mean, we could retain.
Oh, it's not a capital A auditor, it's a lowercase.
I'm sorry,
It's not a capital A auditor, it's a
Right.
lowercase.
it's just a certified
Approved.
auditor. Theoretically, you can retain
Yeah, third party.
Martin Hood to do an
Yeah.
audit. for the- That's what
Well, I
that
think the
means.
way the county is supposed to work is it's supposed to be an initial report that then goes to an outside auditor.
Well-
And that's what hasn't been prepared yet. It's-
Actually, so that's news I have. So, our final, data that they required to perform the audit was turned in. They said they are going through it now. They have pulled in like 3 extra people to get through it, and currently it is looking promising that it will be done before the end of
End of what?
June. June 30th.
Okay.
But your point is that the current bylaws may be inconsistent.
It may be
with what's really-
inconsistent
So it's
with
not,
what's
we're not
actually-
actually discussing the merits of whatever, we should clean up the bylaws.
Yes, we should clean them.
And the state's attorney should review it
And the
first,
state's attorney, definitely should be.
and then we should,
Yeah.
I mean, why not?
So would you want us to send that, or like what do you want to proceed on that?
So I think if, for all these questions, I think first say the initial question, if you would, regarding the fund balance has prompted a deeper dive into the bylaws, which has resulted in additional questions. Could we look at language for the fund balance, while also could you review the present bylaws for some of these concerns and possibly more that we're not identifying at this time?
I just circled 3 or 4 or 5 things John just said there.
Okay.
Not arguing the merits, but we're just saying the bylaws aren't.
Potentially inconsistent.
Inconsistent.
I don't have any more on that. I ran out of bylaws to critique.
Thank you. Any additional comments, questions about anything we just discussed?
I didn't realize we can get paid for the mileage. That's
Oh.
But I thought that was.
Yeah, let's turn that in.
I was trying to remember the last time when anybody's ever done that.
No,
you know?
I don't think it's
I mean,
ever
some of
been.
us, yeah, do.
I think we get like 18 cents a mile, so don't get excited.
Okay.
But
And
yes, you're right.
The federal reimbursement, you gotta travel 75 miles before you can.
Oh, really?
Yeah, it's
Oh,
no,
wow.
no commute. No, you gotta be going somewhere.
Oh, wow.
Okay, it takes us to other business. Our first item underneath other business is slate of officers and elections. It is our annual time for elected position. Those positions, as we just looked at in our bylaws, we were just discussing our chair, our vice chair, and our secretary treasurer's positions. So they are under, on page 3, has president, vice president, and secretary treasurer. So those are the offices that we elect.
I will once
on
again
this
move
body.
that the people in those positions have done just a sterling job and should continue.
Yes, too.
Other than not-
Some here aren't recognized.
Get on the agenda. Yeah, I'm at the meeting, so.
It's a very professional way to say 1, 2, 3, not it. There it is.
I second that motion.
Now they really did make it to it. All right, moved and seconded to maintain current officers in their positions. Any further discussion?
Can we name those offices? for those who
Yes,
didn't?
Krista Jones, Kathy Emmanuel, David Thies. Any other questions, comments? Hearing none, all those in favor?
Aye.
Anyone opposed? Any abstentions? Thank you. Then the next is discussion of our upcoming budget for our budgetary meeting in August. So as indicated before, we do have personnel here to talk about proposals. So I'd like to recognize for discussion of the budget request from Promise Healthcare for general support from January 1st of 2027 to December 31st of 2027 in the amount of $50,000. Individuals from Promise Healthcare. So would you like to both speak to that? Sure.
One thing that I think is important in this current environment is that our self-pay rate is going up. And that makes it really hard for us to do business because that brings in a little less. So it's increasing and it's gone up by more than 10%. So that's hard. It's still really important that we accept all patients regardless of the pay, but that's really important. So this kind of funding really helps us, especially when it's going up. So we're very appreciative of that. Eddie is over our dental
see that we've been increasing every year, 9%, and hopefully, I wanna go 15%. So we're really pushing to take care of kids in the community and outside the community.
Are you doing direct services out of Rantoul?
For dental,
In Rantoul?
yes, we do screening up there. We don't do, any other, like dentist services up there for restorations or extractions or things. However, we have bid for a grant, so fingers crossed, if we can get that, we'd like to get that opportunities up there because still when we're up there, dental is a big deal. Still, they have to travel here, or we can get up there and do some screenings, and so, Eddie's team will go up there to do the screenings.
Are there any other questions? And just so for the record for everyone, this funding is in your packets, is specifically supporting the health of, dental health of children in our county and the dental health clinic going out and seeing those children as well as the additional services that you provide for county children in your offices. If I misspoke, I didn't want that.
And it's also,
Just to summarize.
it's a part of our budget, this is not an add-on.
This has been a part of our budget going on, oh, it's been a while, more than 10 years. I'm looking for the specific, if I go back and look at the specific when it started, but it's been, quite some time. Yes, and this is not fund balance, this has been a part of that we have allocated within the budget. And then based on our conversation at this meeting, we would then give feedback to Mandy on what to put in as she's making the budget for the August meeting. Any other questions? Thank you both so much for everything that you do.
Oh, one quick note.
Yes.
We're no longer known as Smile Healthy. So just one
Oh.
moniker.
We'll make that up.
What are you known as?
Promise Healthcare Dental.
We'll make that update. Thank you for letting us know that. Appreciate it. Thank you both for being here.
Thank you very much.
Our next item is discussion of the budget request for funding of preventative services for adolescents in Champaign County Schools in the amount of $30,000.
Yeah. I'll come up here so you don't have to crane your neck. So this is the exact same that we put forth last year. It's for health education. Before last year, we were just doing teen pregnancy. We were just doing teen pregnancy prevention in an effort to offer a more robust catalog of programming. We've opened it up to like a more general health education, and we have 3 different program tracks that we offer in Champaign-Urbana. So the teen pregnancy prevention education that we've been doing for a few years now, we use the Making Proud Choices curriculum, which is evidence-based, medically accurate, age-appropriate, all those fun things. We also have healthcare navigation workshops for adolescents. So we've worked with Promise in the past actually for basically teaching young adults, adolescents, how to make doctor's appointments, how to fill a prescription, how to talk to your healthcare provider, prepare for your healthcare provider visit, the difference between an adolescent well-care visit and a sports physical, those types of things. And then one popular thing that we've done in Champaign-Urbana is the school referrals training. And it's basically teaching school staff how to be a trusted adult and how to learn and understand the different resources that we have in Champaign-Urbana. So that one is through the University of Michigan Adolescent Health Group. So we've just tailored it to be specific to Champaign-Urbana, Champaign County. So social workers, nurses. We've tried to get in with athletic coaches as well. That has been pretty receptive. So just teaching them how to refer kids places that it's not like a mandated reporting type situation. It's the ones that come like before that. So yeah. Any questions? And there's more details in the actual proposal.
Beth has a question.
Yes. Yes.
Can you talk more about the healthcare navigation portion?
Yeah. Here we go. So it's for ages 11 to 21, so kiddos that maybe are not quite on their own, and then kiddos that, if they're going to college or going to secondary education school, they need to start thinking about how to take care of themselves as far as dentist appointments, regular doctor's visits, insurance. things like that. So it's really like a healthcare literacy training in some ways. And it's really designed to help youth understand how to advocate for themselves, separate from their parent or guardian. In Illinois,
My kids did that.
absolutely, yes, for sure. The doctrine, the actual, like the navigation, the literal navigation of the healthcare system is very popular, but also understanding in Illinois the different resources that kids over 12 can access without a parent. So sexual health, reproductive services, some mental health counseling. There's some things in Illinois that they're able to access separate from their parents. So going through that, and then really the purpose of it at its core is to increase well-care visits for adolescents. So yeah. And then school for
Do you talk about how to make a physical?
Yes, we talk about like the differences between a physical
And a yearly wellness?
and a yearly wellness visit and a sports physical. Like those are all different things.
Yeah.
And you have to be kind of explicit on what you're asking for. And then how to talk through like, what will this cost me? Will this charge to my insurance or my parents' insurance? I don't want it to charge my parents' insurance. I don't want them to get an EOB. Kind of like those prompting questions to ask their provider, ask, the billing folks that they may be interacting with.
You mentioned like clinics and.
Yeah, clinics. So we go through like how to access Promise Healthcare. They're a full gamut of services. CUPHD has specific services, but we're not primary care. But we can offer, the kind of sexual health, reproductive health services if they're looking for that. We do sliding scale fee. So it's not free, but low cost, affordable.
I found this on the web for sexual health, reproductive health.
Serious listening. So it's very popular. We have a version for parents and guardians too, which is less popular, but surprisingly. The kids like it. The kids are interested in it. It's festive.
I just want to add that our health educators, they are so great. I hope that you can come one day and meet what they do. I think that they're very passionate about it. I don't know if you follow our social media, but our Facebook, they will share pictures of the things that they have been doing. So I fully support this, of course, but I think that would be great if we can secure this.
Thank you very much.
Yeah.
Any other questions for Whitney?
Well, we, of course, this gets into the discussion we've had about, so this is
fun
becoming a
balance.
recurring
It is
program,
recurring, yeah.
right?
Yes, it
And
is.
how does it fit into the budget?
Currently this money comes out of the fund balance. If we would put it into the budget, for a balanced budget, we would have to take something else out, correct, Mandy? I don't think there's any room.
I haven't worked on this yet. I know we're close.
Yeah. In the last couple of years, we have funded it specifically out of the fund balance because there's been no leftover funds in the budget after we do the 50,000 for the dental health. So if we wanted to make it a part of the budget recurring, then we would essentially need to look for more revenue or cut something else. And that might be a question if that's what the board decides to do. We really want this, we want Mandy to look at, can she put in the budget every year, and we direct her to do so, then ask her to come back to us with where might it hurt the least if we have to cut something else.
Yeah, I see an arm wrestling match.
Yeah.
Are there any grant opportunities for things like this?
Are there grant opportunities for things like this?
So unfortunately, it used to be covered by a grant, and that went away, so which is why we're looking for support from the
Are
county.
we sure it's gone and didn't come back?
It didn't come back. It has not come back. It was Title V funding.
Okay.
So they reworked that a little bit. There's a stronger emphasis on oral health, which we have a grant for that. But the healthcare navigation workshops and the school referrals training were both under our adolescent health grant that we had for probably 5 years, and it went away 2 years ago and has not come back.
And are you surprised?
Yeah.
So to the question of, are we discussing that or just asking?
We got one more, and then, yes, then we're gonna discuss them all.
I'll wait till
Do you have any other questions for Whitney specifically? Okay.
I'm the next one too, I think.
Oh, all right, you're on.
Yeah, you get to talk to me. Oh, this is the
request
budget.
For the food
Yeah.
access specialist.
Yeah, okay, so this is the budget for teen pregnancy, or the health education, that's in there. That's making pro choices.
Can I give a quick
Yeah.
update on that? So
Yeah.
on our last meeting, I brought this food access specialist, that it's a new initiative that we are planning, and that we're planning to sustain the position. And I think you mentioned to put it on this agenda so that we can talk more about it, but I just want to give that quick update on that.
Now, this is
the-
a program that the district is doing as well. Okay.
Yes.
Yes. So, we got a grant from the Illinois Department of Public Health last CPHC fiscal year, so July 1 of last year, that will end in June. And it was to focus on a social determinant of health in Champaign-Urbana, Champaign County. That was something that needed to be worked on, so we chose food and nutrition access security. So with that funding, we are putting together what we're calling, this is not official, but like a food access alliance with growers, public health, social service entities, the university, hospitals, schools, all of those things. And with that, we've also hired a food access specialist. So CUPHD got the grant, and we've hired this food access specialist with help from our core partners like Sola Gradia, Healthy Champaign County, Land Connection, those types of folks. And so that grant funding is ending in July, and we've secured funding from the city of Champaign to maintain us for another fiscal year. What this money would be supporting would be Champaign County zip codes that have higher percentages of food insecurity. So the funding from the city of Champaign, they do understand that it covers Champaign County as a whole, because we have to attack it kind of from that level. And a lot of the big food access players are countywide. Some of the bigger ones, like the Eastern Illinois Food Bank, that's a huge, region. So the city does understand that it will be more than just City of Champaign benefiting, but they do want to see effort from us to be like branching out in little funding spheres. So we have money from the City of Champaign, we have money from the Lumpkin Family Foundation, and we have money from the Campus Community Compact to sustain the food access specialist and to get the Food Access Alliance kind of up and running and self-sufficient hopefully at some point. So this money that we're asking from you guys is specifically for Ludlow, Rancho, and Thomasboro. They have higher rates of food insecurity compared to, well, except for Thomasboro, but compared to Champaign County as a whole, and then the state of Illinois. So just doing a little bit of a deeper dive in those 3 zip codes to see if there's any potential solutions, any basically like little mini needs assessments in all of those 3 towns.
Is this seen as a recurring program?
So the idea is to sustain it, because I think with the support of the city and also the grant that's ending, so we really hope to sustain this, because if you look at the county as a whole, you would feel like there are areas that we are food secure in terms of. But if you dive deeper and look at the data, there is a hotspot of areas that are very insecure in terms of accessibility and food security.
And is that really related to poverty more than anything else?
Yes. And I think that one thing that I'm excited about this is that when you share the idea, Lumpkin Foundation, they give us money to do like a small amount to help. But the city of Champaign, I think they don't have the staff and the capacity to bring people and implement this. So we already secure a fund. We have a staff that's hired. They already started the initiative that Whitney was talking about. That's not out yet, but they're brainstorming about that initiative. So and there is a lot of buy-in on Sola Gradia, like all these food coalitions that we have in the county that have seen needs. There is a lot of buy-in of those coalitions. So I think the idea is to sustain this until we find something bigger. But I just know that the staff that we hire are very dedicated and they are very passionate about this. And on top of that, they're using this as also support for our food summit. I don't know if you guys heard that, but we do a food summit and we bring folks from all over the county to talk about food insecurity and how we can do to solve it. So I had a chance to participate in that this year. I think it was really eye-opening about how some areas in the counties are very struggling, and the discrepancy is very eye-opening. And we, as a community organizations, we really want to take a lead on that. And I think that was the background why we secured the funding with IDPH, and we really hope to expand it or to sustain it. So. I don't know if you want to add anything because you're fully.
My only thought was that the food access specialist was actually an idea that came out of the food summits. This year was our 4th food summit. And last year is when they kind of pitched the idea of like, if we had a food access specialist, someone that was owning all of this work and bringing everybody together, what would we want this person to do? So that was the group that like made the first draft of the job description and the duties and things that they would want to see happen. So there's a lot of buy-in from a lot of different people. I think in the simplest of terms, we're using these 2 years of grant funding to get to something a little more sustainable so that like CUPHE could put in a little bit of money, United Way could put in a little bit of money. Similar to how we used to fund the I-Plan position, that people, the bigger fish that were invested in the work could, chip in a portion of portion of the work. So the cities, yeah.
So my question is the 15,000 going to salary? Is it going to mileage? Is it going to both? Is it going to food?
If you go up a little bit,
That's what I'm like, yeah.
down a little, sorry, other way. My bad. Keep going. I think I put the budget in there. Keep going.
41.
Blah, 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 blah. I think most of it is salary. Oh, up one more. Sorry. So sorry. Most of it is salary for our food access specialist. Salary and travel, and then the supporting materials are things like if we had community engagement events, data collection activities in those specific areas, like if we did a needs assessment or listening sessions or things like that with folks that actually live in those areas, that would be funds to support those activities. Evaluation summaries, things like that. So it's mostly salary, I would say. 8,000 of the 15,000 in salary, and then a little bit more.
You made that clear. There is already someone in staff who is doing this.
Yeah, that's kind of,
I just wanna
I've
make
seen
sure,
this,
yeah.
but I wanted to make sure it
Yeah.
was all the same from what you put in the
Yeah.
packet. From what you were talking, it sounded a little different, so,
Okay.
so thank you for clarifying,
Yeah.
I appreciate it.
I guess, why is Thomasboro included based on the food insecurity rates that you're talking about?
It is higher than some like other places, and it's so located with Ludlow and Rantoul. I felt like it was high enough to be included because the resources in Rantoul are going to feed into the Ludlows and the Thomasboroughs of the world. It's not like super duper high, but it is higher than what we would like to see.
So what's one of the biggest barriers? Is it just are people in a rural area and that's where, so they have, even though they're surrounded by like fields,
Yes.
Oh,
which
yeah.
is ironic, I think.
Well, a lot of our farming and agriculture goes to feeding livestock or
Yeah.
ethanol.
Ethanol.
A lot of it is not.
Right, I know.
We don't need a lot of it.
Yeah.
Which is unfortunate.
I mean, no.
But we've been very successful implementing community gardens. We have our garden. There's a Randolph Street garden. Our partners are pretty good with that. So.
Or the concept of like hawkers markets where you have a bunch of different vendors, and so because like obviously buying the groceries is expensive, but if you can have like fresh, it brings community together.
Yes. Yes.
That
The
could
farmers
be
market
something.
model. Yeah.
Yeah.
Do you go to because I know every fall we've got people leaving zucchini on porches and throwing them
Yeah.
away, and is there, do we go out to people who are
We have a program, or we partner with a program. I think it's technically through Cunningham Township Solidarity Gardens.
Yeah.
And so you can bring in all of your extra crop,
Yeah.
and they distribute it to places that need it. So we give it out in our lobby up there. We give out a ton of pounds of food from ours. But Solidarity Garden is kind of what you're talking about, of like people that have, one person doesn't need 40 zucchinis, you can donate it, and then they get to where it needs to go.
Awesome.
Yeah.
Any other questions for Whitney? Thank you.
Yeah, thank you guys.
So we've heard 3 proposals, as we have discussed before. The $50,000 of the first proposal with Promise Healthcare, that has been incorporated into our budget for more than 10 years, probably closer to 15 years. It's been a long time we've been funding dental health care in the community, kind of as a standing line item in our budget. And then the sexual health education and this new food specialist position, those would be the sexual health education we've been doing now for 4 years. Yeah, 4 years. And that has been out of the fund balance. This $15,000 for the food service specialist position would be new, and what we would have to decide is that would we fund those others out of the food balance? Do we want to keep the Promise Healthcare as it is? Kind of take them one by one, say yes, we want to keep them, and then kind of decide, is that going to come budget or fund balance, so we can give direction to Mandy as she's putting things together, as I said before, on whether or not if we want something to be in there consistently year to year, what changes would we need to be looking at in the budget to allow that to happen? Also knowing that salaries are going up and there'll be new portions of those into this year's budget. So there's always new sources of expenses. If we don't have new sources of revenues, we have to then therefore cut.
Well, that's why it's also important to hammer down what we're gonna call a carryover.
Yeah, the 25 to 35%.
An accurate
yeah.
figure there, but that, if we look at a $1.2 million budget, which is our budget, 25 to 35% of that, we're probably over that currently. However, at some point, if we start spending it down, then we won't be over it anymore. So we're going to be faced with just exactly what do we do when we're adding new programs like this.
So maybe let's first, for the interest of time, the initial proposal from Promise Healthcare. What are the thoughts on that, on funding dental health at $50,000 in the community?
I'm certainly in favor of keeping that going. Yeah.
So we're all in agreement?
I agree with that, although, is this a competition among the 3?
Is it a zero-sum game?
Or
Yeah.
are we have agreed that we like all 3, and now it's the question of, are we doing it as a regular part of our budget or as part of the fund balance? I would like all 3 of them to continue, but if we are comparing and contrasting, it's hard. I mean, I think they're all good things, but the dental strikes me as, there's no other place that kids get dental services.
Right.
Sex education, theoretically, every school board and through their teachers provide it. They may not be doing a good job. You do a better job. I remember at Yankee Ridge School, the health teachers did it. So there's another way of getting it done. I don't know about the food access specialists. I can't quite compare and contrast in the same way. It's mainly the dental stuff for kids, it strikes me, is really critical. The others aren't, but that's not what it is.
Well, should we let the district staff see if they can come up with a solution?
I think that's a good idea.
Yeah, could we
So I'll
get
do
just
it.
prospective budget? Like, if this were in the budget, this is where the shortfall would be, and this is where, we have.
Can you do that, Angie?
I remember.
Oh, so what Beth and what Dr. Peterson and David have all been saying is, if we agree that we're all in favor of funding all 3 of these with outside the fund balance, can we get perspective from you on where the shortfalls might be and what you would recommend if we made them all a part of the entire budget rather than taking from fund balance? And then perhaps maybe have 2 budgets for us, one where we would not have a shortfall and we would utilize the fund balance to cover things, and one where there might be a shortfall and here's where you might need to make cuts. Does that make sense?
I can tell you that it really did, a lot of this is gonna depend on we came up with it should be more than a 38% fund balance reserve. So that's one thing.
38% of what?
The 1.2.
The total fund balance should be that you should keep on hand for the emergencies.
Yeah, but 38% of the 1 point, what's the big number? It's not 100%.
That just it. I don't know which one of those numbers.
That's why we can't answer these questions
Right.
unless we have what Travis needs to give us.
Right.
Is there a reason he can't just send an email with numbers in it? Does he have to come and make a presentation? I mean,
Well, I can't.
We've asked for both.
and gotten either?
Correct.
Okay.
But we haven't, I think the last was, there was a conversation about he was still doing some budgetary things for the county, so we didn't know yet. And
Well,
so I don't know if that's
he
concluded.
claims that he, when we had the teleconference with, that he didn't have the methodology to separate that piece, and new board members may not quite understand this, because it used to be well explained before you got on. In the property tax, there is a public health line item, and it's collected for the city residents. The county's tax is enumerated, but the city's portion is withdrawn to the district. And so currently, there is a $2.2 million property tax line item for public health. But $1 million of that goes back to the district, and it's not available to us. So our actual budget is 1.2, around in there. So we had been getting 25 to 35% estimates in terms of our carryover off of the 2.2 million, which is not our budget. It's higher than our budget. Our budget is 1.2, so 25 to 35% of 1.2 is much different than 2.2. So what we've been carrying over is actually larger than what we targeted as a requirement. And so that all needs to be straightened out. Now, as we've talked, is it a bad thing that we're carrying more than 35% if we hit another COVID?
But I assume that when they did their analysis, it came up with 38% of something. We gotta know what something is. There was data, there was judgment that went into that determination. So, including what you just said, John, that what is reasonable for us to hold back in case we hit another COVID? Is it 38% of 1.1 million, or is it 38% of 2.4, or whatever it is?
We had to take that
That's
whole
what I
COVID.
don't know. All I know
We
is that
wiped out.
Yeah.
the reserve thing that we did the calculation on, it had a bunch of questions that we answered and then it scored it. And then at the end, it said that you should be between this percent and this percent and this percent and this percent. And our scoring came out to be about 38%. But again, I don't know what that's going to be of, because I don't have Travis's.
Well, you must
Or
have,
maybe you
when you
guys
said
would answer.
38%, you must have known what it was then.
No.
Well, how could you come up
Because
with
it was
38%?
like I said, it's a bunch of questions that gave you scores. It was done by the Governmental Finance Officers Association. It's just a questionnaire with scoring sheets. So there's no dollars associated with it. It was just saying you should have 15 to 20%. You should have 25 to 30% if you fall in this way. If you fall in this way, you go to this. We fell into the highest range the way we filled out. But we needed Travis to confirm that we were filling it out because we're not counting for this week. So we were doing the best we could to fill it out. And then he needed to go over that.
And there's professional judgment that goes into that. But having lived through COVID, I don't live in the percentage world. I live in the, how much do we need for contact tracing? $500,000. That's not a percentage, that's a number.
Yeah.
Yeah. But again, people who are public health professionals look at this and come up with a number of 38% of whatever it is that you're calling your fund balance. Okay, that judgment goes into that. Maybe that's right. That's a good number. I just know that the actual cash we need on hand is.
I can tell you that, like with COVID, I mean, that was a really up-the-wall thing. But you gotta remember, we got grants sent over like
Oh, I
$9 million.
I know. That's
So
right.
you wouldn't have had 38% of that sitting back. You're not expecting that.
I get it.
This whole, right, we're considering 95,000 roughly,
Yeah.
right? Out of like 1.2.
1.2 million.
Yeah, so like, we're talking about a 10%.
Well, 50 is actually already in
That's a,
there.
that's a
That's,
lot. That's
I
a big
guess.
chunk.
One thing that I would like to talk to you guys on is every year, I don't
It's
think you
not-
guys ever mentioned this to
We
you, but
always
every
separately
year I
consider
told
it, but
her
it's been part of the
that
budget.
I have cut down our
So
administrative
it's the
expenses.
two new things.
I'm not charging as much as I should be, because the money's not there. So each year, I'm reducing that amount that we get for administrative expenses. And then, it just left my brain.
So you're charging less for the stuff that
You're talking about what we're paying CUPD. You're cutting,
CPHP for administering,
you're cutting down.
yeah, we're cutting the administrative expenses
And
down.
you're getting them from somewhere else.
It's
or-
supposed to be 9% of budget, basically. And each year I go in and I reduce the amount that I'm taking because it's not there to take it.
But you're getting it from somewhere, because,
It's coming out of our budget,
yeah.
the district budget.
Oh,
That's your
okay,
point, that's
yeah.
your point.
Thank
It's
you
not-
very much.
You're not cutting the salaries. You're not cutting salaries, you're,
No.
you're.
The district is supplementing the county's budget, basically.
So, Mandy, before you put in the fund balance, you've got the revenue, you've got the expenses. The fund balance comes in as that last line item before
Right.
that. So what I'm saying is, can you do a budget that would have this in it? After hearing that, probably no, we're taking more money out of the thing.
That's the way I do it, I take
Yeah.
it out, so it's kind of like, how do you want me to do that?
Right, if you would took, the 50's already in there, and if you added the additional 45, where do we need to take money away from? So that's what's back to these questions for shortfalls, without the fund balance, we're not talking anything about the fund balance, just the budget. And then if not, then we'll know, here's how much we need to pull from the fund balance while we're waiting for Travis to get the information of whatever that number is, if it's 500,000, 400,000, whatever the fund balance is. When we get that information, then we can better make that decision on where we would take the money from to fill any shortfalls. But I think what we were asking initially is, where would be your recommendation if we say we're gonna fund all three of these projects and we're gonna make them a part of the budget and not fund balance, where would we take cuts from elsewhere, outside of administrative expenses?
I think that's something that I'm gonna do and I can talk about, because it's, my understanding is we don't wanna cut any of those. I mean, you've got your core services, that's all we're charging for. So, I'm not really sure where you would take it from.
Okay, that's what we're getting at, yeah, I think that's the best question.
Yeah.
And that's why I take it out of administrative services, because that's the only place that I feel
You can
I
save
can
it.
take it from.
Which might mean that it is somewhat a competition between the three programs.
Yeah, zero-sum game.
We have to decide, you know.
But yeah, how bad is it? Like, what is the number that how much is the number we're choosing? Like, how much over?
As opposed to 95,000.
Yeah.
So if we said seven, and I started by saying, I think the dental services is more critical.
Yeah.
That's where I started, with three really good programs.
I know, yeah, that's Sophie's choice, yeah.
So my,
The other thing I want you to be aware of, and excuse me if I'm speaking out of line here, but one of the things that we know is in core services is that environmental services. You got your communicable diseases, your STDs. The environmental services is the only place that we know that we can raise fees. And they haven't been raised in over 20 years.
Oh, wow.
Yeah, let's spread the.
It has been brought up before by a previous director, and whatever reason it didn't pass or whatever at that time. We are currently in the process of trying to get that passed in the district. So that would be additional revenue that you guys could also implement implement
For the county.
and be able to offset some of this too. Because I don't know, I can't speak for county side, but for the district, I think Sarah said that she expected us to get about 100,000 more a year. So you're looking at a substantial amount of money because we'd be doubling those fees basically.
Can I speak on those? I think last time I briefly mentioned increase of fee because we did a study, and Mandy's right, the fees hasn't been increased for 20 years.
Right.
We did a study comparing.
I remember this.
Yeah, you remember that? We did a study comparing, and I didn't have any data because we want to make sure first that we pass it through CU board. But the board recommendation was to send it to restaurant owners to get their feedback. I think during the week, Sarah said that we have at least 80 to 70% positive feedback for increasing the fee because it can allow us also to do some recruiting because there is a lot of turnover on EH because the salary is really low for the quality of stuff they need. So I think the EH1 in training is 45 for someone who have a college degree in science, and you have to have 32 hours. You know, we can get into detail, but what I'm trying to say is that the salary that we propose for those health inspectors is very low compared to the county, compared to other health department in other jurisdictions. So the study that we did is that we compare our population size to Peoria and I believe Lake County, because we have the same population size, and then we try to look at the number of food services that they have and the number of inspections that they do every year, and then compare their fees to our fees. It's like some of their fees are like tripling our fees.
Yeah.
And it was like we're like, okay, we don't wanna raise it to that level, but we want to take averages of those three studies that we did. So we take those three county, get the average, like add it up and get the average, and the average is, you know, compared to the fluctuation of those pricing for those three county, we take the average. And sometimes we're even lower because we're like scared about how big of an amount. I think most of it for food inspections for level 1 food establishment, it's probably like doubling what we currently have, the fee that we currently have. But I think that's something that we really want to do because it's getting to the point where EH is not self-sustaining, and we have to like pull all the time our fund balance to make sure that they're competitive, and also like just to even last week one of them left for Boston, and we have been training this person for 2-3 years, helping them pass you know the certification, and they got the certification and just
They took off.
so these are the issues that we're dealing on, and I don't know. And most of the time when we talk about increase, I think based on Sarah's inputs that she sent information about getting people's input, like a restaurant owner, she said there were a few negative comments, but mostly 70 to 80% want the fee increase. So I don't know how we go from there. So we had our CU board meeting, so we plan to discuss that. But I think the sooner we'll do this, the better place it will be, because we have to take 1 year to collect those increased funds to see the benefits.
I do have a question. How does that square with P-TEL?
How's that with what?
P-TEL, it's a countywide thing that was passed in '96 that says you can only raise the sum of all fees, percentage cost of living increase, whatever, can either be 5% or the cost of living increase in general, whichever is lower.
Yeah, so
per year.
our initial thought was to just do an increase, but one of our CU board recommended to do an incremental.
Yeah.
So they want to do an incremental fee increase every year. Like, this is our target.
Build that in as a cost of living increase.
Yeah. So I didn't know about that law or that, but I think that's probably what she was thinking. I didn't expand on that, but she said to do an incremental fee increase for 3 years, but still, you know, it will come to that. right number, golden number that we're looking for, but it will take time for us to sustain staff.
Right.
And really, I've been to administrators' meetings. We have one of the most unviable EH. I know that there's a lot of things going on in the county about how strict these people's, our staff are in terms of, regulations and regulate things. But this, like, when people need, when other health department need resources or they need advice, instead of IDPH, they will reach out to us.
Yeah.
And if IDPH want to hire, they come and target us. But I'm just saying that, like, we just need to know what we have and really, like,
So-
retain our staff. And
If you could, is that going to be happening with the district within like the next month or two? Is this something we can vote and look at in our August meeting? And then my question to Beth back would be, is, because we've got to deal with the county board as well. So would the county be supportive of that?
We are supportive of anything that is bringing in revenue. However, we do have to make sure that we are not violating that.
what is the law again that you said?
Let me send you a link to it. It's-
Well, then why don't you bring in a data center?
So, yeah, exactly. Here's the other thing too, you could probably address a couple different things. So what if you were to incentivize communal food options, like a hawker's market, where you have multiple people who are providing food in one area and have them have lower fees than standalone restaurants, which would probably make the standalone restaurants upset, but.
So that's the, the board specifically for Champaign and Urbana. So there is already thriving business here. I mean, like, when most people, food establishment, I should say. So,
Only
so most of the time I was at the business development forum today. Most of the time, they usually want to change everything and bring other food establishments. There is a lot of process that go to that. And one of the things that the health department has to do is plan review. So that is when we can't see eye to eye, because we have to always figure out when revenue change, when menu change, process will change and equipment will change. So sometimes it's really difficult for a business owner to know that, all right, I'm moving from a burger style of restaurant to a drinking, style. So like the process going through that, so they don't want to change any of their equipment that it's costly and we have to follow the regulation. So those are the things that's going on in terms of the idea that you bring. So I really feel like, I think based on the study that we did, if we bring that data in and show you guys, I think it would make sense for me to do an incremental fee increase year by year, not violating this law for sure, but to start on this as soon as we can. And to answer your question, I think that for CU, we do board meeting every month. So we can definitely, because their request, they were not against it, their request was to send an email and informing business owner, specifically restaurant owner, about the increase and get their input. And according to my latest communication with our EH director, she said that most of those were positive feedback. So I think that the next step for us is when we're meeting with our CU board to bring that news to them and see what did they want us to do next before we do the increase. And then after that, I think we will have more time to present something in the August Board of Health meeting if you guys want.
Yeah, let's put that on the agenda. And what I'm hearing is there is agreement for the dental program, and then the potential for looking at the other two programs, possibly those funds coming out of the fund balance. That's a vote we can take in August on whether or not at that time, if that's our only option, we want to do that out of the fund balance or not. Excuse me, my apologies. Once we have a better idea what that number is. Does that, am I hearing everybody kind of just summarize where we're at?
And how much extra revenue would be potentially brought in, if we did raise fees, because that could start to pay for some of this.
Yes, for county, I don't know, but for CU, I think it was about more than 100,000.
Yeah. And I think,
Yeah,
to Mamadou's point, for this conversation next year, if we start it now, those funds would be available looking at the next budget cycle, right? Yeah,
Right.
because they would be collecting them
Yeah.
over and we could get a better idea of how much is in there. And I agree to your point, then next year, the conversation may be, we put all three in the budget. And we won't have a shortfall that takes out of administrative expenses, hopefully.
Is there any way to cut, like, with the sexual health portion of it?
Well,
I know.
On that point, I have a
Yeah.
question. I think I know the answer. I think you're gonna say it wouldn't be much of a savings and probably wouldn't be well accepted. But is there any argument that instead of hands-on, where we perform the program for preventative health, it instead becomes a training for school health teachers, and where you brought the resources and cut back the time you had to spend doing it? I know you have to have buy-in by the school districts,
Yeah.
but they're responsible ultimately for that. They have people who are on the front line, really. Can we save some money by making it a training program for the school districts?
You technically could, I think that would, like, time-wise and supply-wise, it would probably save money. The buy-in, I think, is where it's gonna get tricky. If you could get that as like a, continuing education for,
Yeah.
that would be really good,
That becomes a
but
question of persuasion and
Yeah.
it's political, and I get
Yeah.
that, but
that could be an option.
scarce resources, we can't fund it.
Right,
Yeah.
that's true.
I'd like to know if that's.
Yeah, I think the idea is good, the buy-in, I don't know, that might be testable. I know, Races has a similar program for their errands law education, that it's like a train-the-trainer model, it's not as, I don't know, used, I guess, people don't access it as much. And I think it's just because asking for more teacher time is tough to do. If that makes sense. Like, especially if you're trying to get to them during their teaching day, they're pretty hooked up. But if we could get it into a
school
retreat.
district, they have their own revenue sources.
Yes.
They can hire another health teacher and let the health teacher go to our training, and then, I know it's scarce resources, but
Yeah.
we don't have it, we don't have it.
Yeah. It's a super interesting idea, though, I like it.
Any other questions on either one or two or three of these
So,
budget items?
so I think we'll hear about it in August and
Yes.
make a final decision.
Yes, so I will, Mandy, have you, the budget, the 15,000 for mental health in it, and then potentially out of fund balance, the funding of the other two, potentially. Like you
Oh,
know,
the directors, yeah.
Thank you. And then, I'll copy you on my communications with Travis, I'm gonna try to get you.
Well, I think he'll be a little more free after the end of this month.
Yeah, I think so too. Because like when he responded to Amy, he did respond quite quickly. He was
That would be
trying to get the answers, he was still embroidered with some things, so. Anything else that I missed from anyone on that?
Yeah, email.
Okay.
Okay.
Item K, public participation on non-agenda items. And I don't think we have anyone left from the public here.
They're just
Our-
take a number for better service.
Yeah. Our next meeting is August 18th. That is typically, as everyone knows, our longest meeting of the year. So just plan on that. That'll be the budget meeting.
Do we bring our
So
cots?
we'll have, yes, there you go. Well, we don't actually need to bring them because we have the shelter, so, we
Oh.
can probably find ourselves one. Yes, so please, understand that, August 18th at 5 o'clock here. And having said that, I would then entertain a motion to adjourn. So moved. Moved, seconded, moved and seconded. Any further discussion? Hearing none, all those in favor? Aye. Anyone opposed? Any abstentions? Thank you guys very much. Great questions. Thank you. Thank you, Mindy. Thank you, Whitney.
I can't wait to learn more about this communal living thing. it's such a fascinating thing, and I was also thinking for people, well, I don't even know if you could also do it with people with like intellectual disabilities, like who are the relatively higher, Dr. Peterson, and like the transition.